As far as P1s, I think it just comes down to trying to learn time management skills early, I guess. I don't know that it necessarily comes down to how many clubs you were in or how many organizations you were in or how many leadership roles you necessarily have. All those things are really good, but I don't know that those necessarily prepare you for residency. I think just having a lot of things that you're interested in and a lot of things that you're doing are the best way to prepare, because residency year isn't just one thing that you're doing all the time. You have to balance a lot of different tasks, including your personal life. So I think that if people get more involved in things like the organizations and they learn to balance their time better, and I think that's the most important thing.
Well, when you're in pharmacy school, I mean, the main thing is just studying and, working on getting decent grades. Most more competitive programs, you have to have somewhat good grades. You don't need straight A's.
I think one of the important things that a lot of residency programs look for are activities in clubs and also professional societies, so ASHP, APHA. Also, just kind of delving into and getting as much clinical experience as you can, either working in a hospital setting or even retail sometimes.
For me, I would feel that study hard, read a lot, not only from the lecture that the teacher gave you, but read DiPiro pharmacotherapy or Koda Kimball, because that gives you the kind of the real understanding, not just to memorize to go for the exam. It prepare you. So I would say read a lot.
I guess maybe more research experience might have been nice. It's a nice CV builder, and it's a nice thing to get exposed to early on to know if you like it or not, which I didn't really have a whole lot of exposure to that, so that might be something.
As a student, I did a lot of clinics and that type of thing where, like blood pressure screenings for patients and stroke awareness type things, heartburn awareness campaign we did. And I guess all of that helped pique my interest as far as like staying in the clinical side of pharmacy.
The application process is pretty tedious. So knowing a lot about the programs and kind of putting it all together like in a binder is really helpful.
Talking to the current residents now, talking to P4s who have applied to residencies, seeing what types of rotations there are, what other opportunities there are, getting involved in organizations. I know many of the organizations do emphasize residencies, and there's multiple residencies. You could do community residencies, you could do specifically for primary care, you can do the pharmacy practice, there's managed care, so there's a lot of different residencies out there. But just get involved and talk to advisors, talk to those who are ahead of you in your classes.
Start looking at the ASHP website and looking at residency opportunities and places to go.